Hello, I'm Dr. Brittany Panico, board certified rheumatologist at Summit Rheumatology in Gilbert, Arizona. And I am going to talk this week about back to school concerns and things in rheumatology that college students or younger adults may face during their back to school transition. So one of the hot topics lately is how do you know if you need a rheumatologist? And as much as this applies to our patient population who are maybe new in town for college or returning to school in the area, this also applies to anyone. Anybody who feels that they could benefit from a rheumatologist can benefit from these videos. So I hope you enjoyed this weekly series, and we're going to talk about psoriatic arthritis today. So if you're a patient who has psoriasis or a skin rash that maybe has been called eczema, it's possible that it's actually psoriasis. And it's possible that you also have joint pain or joint discomfort or back pain or possibly eye inflammation related to the underlying autoimmune process of psoriasis. And when the joints are involved, we then term that psoriatic arthritis. So a lot of patients come in not specifically knowing that they have arthritis, but the more that we talk about their symptoms, the more we talk about aches and pains and back pain and neck pain, the more we can actually uncover that a patient may have psoriatic arthritis. So I encourage you, if you're someone who has psoriasis, maybe little patches of flaky skin, maybe you have scalp dandruff that you're trying really hard to hide and not pay too much attention to, it actually could be something that has a broader implication for your overall joint health. And it's really important to tease out those symptoms that you may brush off as being normal. When you wake up in the morning, if you have more than 30 minutes to an hour of stiffness in your joints, in your fingers, in your lower back, in your neck, it's possible that it could be a type of inflammatory arthritis. So combine that with a rash like psoriasis or eczema, then that may be your defining symptom of psoriatic arthritis. And it's really, really common to say or brush off having back pain as being normal or related to too much exercise or related to being active. If you're somebody who finds that you have to wake up and stretch in the morning in order to get yourself going, that's a coping mechanism that we develop to help actually ease the discomfort that you may have waking up with joint pain or back pain. So for those of you that find yourself not able to make it through your day without stretching or exercising first thing in the morning, again, pay attention to why it is that you've developed that habit. Did you know that a lot of people find that modifying their behavior actually delays diagnosis because we just automatically assume that you have to do certain things to make it through your day? So I want you to pay careful attention to if you are somebody who relies on exercise to feel better, and not just feel better in the sense of your mood, but feel better in the sense of your joints. And particularly if you're someone who is young, like college age or under 30. So I hope this video helps and encourages anyone who has psoriasis and joint pain to seek out a rheumatologist and uncover whether or not you may have psoriatic arthritis. Summit Rheumatology is accepting new patients. We also do telemedicine if traveling to Gilbert is not feasible for you. Please be sure to mention that when you call or email for an appointment. You can find us at summitrheumatology.com or email at info@summitrheumatology.com as well. Thank you so much, and we'll see you for another episode of Back to School Basics. Thank you.